if I ask you one question, is it just dust or is your breathing trying to tell you something? Hello everyone, I am Dr. Shambo Samrat Samajdar, practicing at Allergy Asthma Treatment Center, Moulali. Let me begin with a scene many of you know too well. You wake up in the morning, your nose is blocked, you sneeze again and again, your eyes itch, you think maybe it is just the fan or AC, or maybe it is the weather. Then, while making the bed or cleaning the cupboard, you suddenly cough. Your chest feels tight. You hear a faint whistle when you breathe. That whistle is not background music. It may be your lung asking for help. So today I want to talk about asthma, allergy, dust allergy, and treatment many patients have heard about but do not fully understand. Allergen immunotherapy. So asthma is not simply a breathing difficulty, it is a condition of airway inflammation. The breathing tubes become sensitive, swollen, and narrow. That is why symptoms may come and go. Symptoms like wheezing, cough, chest tightness, breathlessness, nighttime cough, and or sometimes early morning breathing trouble. Many patients say, Doctor, I am fine most of the time. But asthma can be quiet for weeks and suddenly flare up when exposed to triggers like viral infection, smoke, pollution, strong smells, exercise, weather change, or allergens. Now let's talk about one of the most common hidden triggers, house dust mite. When patients hear dust allergy, they often imagine visible dust on tables, right? But the real culprit is usually not the dust itself. It is teeny, very tiny living particles called house dust mites. Especially, they are found in mattresses, pillows, blankets, carpets, and soft toys also. They actually love the warmth and humidity. You can't see them, but your immune system may react strongly to them. Dust mite allergy can cause repeated sneezing, blocked nose, runny nose, itchy eyes, sometimes post-nasal drip, something trickling down from your inner nose to throat, then cough, poor sleep, and in some people, asthma worsen. A child who coughs every night, a student who cannot run without wheezing, an adult who keeps using a rescue inhaler again and again. Sometimes the trigger is right inside the bedroom. So, what can you do? First, do not ignore symptoms. A cough that keeps returning, wheeze, chest tightness, or breathlessness should be assessed. asthma should be diagnosed properly with history and lung function test when possible. Second, control the environment. Keep the bedroom simple and clean. Don't clutter your bedroom. Wash bed sheets and pillow covers regularly. Very importantly, use at least hot water, 60 to 70 degrees Celsius at least, 3 to 4 days interval. Wash those bed sheets and pillow covers every 3 to 4 days interval. Please do that. Keep it in that hot water for 30 minutes, then wash with soap as you wish. Use washable soft toys, or better, keep them away from the bed. Reduce indoor dampness or mold. Mold is a very important source of allergy. Avoid smoke exposure. Remember, a clean looking room may still contain allergens. So the goal is not panic cleaning, because it will again create some other disease, obsessive compulsive disorder. The goal is smart reduction. Third, use asthma medicine correctly. Many people fear inhalers, but the real danger is uncontrolled asthma. Inhaled medicines, when prescribed correctly, go directly to the airways and help control the inflammation. Do not stop inhalers just because you feel better unless your doctor advises you. Also, technique matters. An inhaler used wrongly is like a key put into a wrong lock. So now the important question, doctor, can allergy be treated from the root for selected patient? Answer is yes. Yes, we can consider allergen immunotherapy. What is that? First of all, we need to understand allergen immunotherapy is not a quick decongestant or not a cup syrup. It is a long-term treatment designed to train our immune system to become less reactive to a specific allergen, such as house dust mite. It usually considered when allergy testing and your history confirm a relevant allergy and symptoms continue despite good avoidance measures and proper medicines. So there are two main forms. One is subcutaneous immunotherapy, allergy injections given in a medical setting. The other is a sublingual therapy, some tablets kept under the tongue, depending on the allergen and the availability. But very important to note, treatment often takes years. The guideline says commonly around 3 to 5 years. And it is very important to remember clearly, immunotherapy is not for everyone. It must be started safely. For an example, if asthma is uncontrolled, immunotherapy can be risky. So your asthma should be well assessed and controlled first. This treatment should be prescribed by those specialists who are practicing in the field of allergy for long time after proper testing using correct allergen and safety precaution. So here is my message today. If you sneeze every morning, do not just blame the weather or your air condition machine or your fan. If your child coughs every night, do not just blame cold drinks or ice cream. I am not recommending them to take ice cream or cold drinks. If you wheeze when cleaning the house, do not just blame your weakness. Your body may be showing signs of allergy and asthma. And earlier we identify it, the better we can protect your lungs. Asthma is controllable, allergy is manageable, dust mite exposure can be reduced. And for the right patient, allergen immunotherapy may change the way the immune system responds. Breath should not be a struggle. Sleep should not be interrupted by cough. Running, laughing, working, studying, this should not be limited by asthma. This is Dr. Shambo Samrat Samajdar. I am a clinical pharmacologist and a physician at Allergy Asthma Specialty Clinic, reminding you, listen to your nose, listen to your lungs, and seek proper care before a small allergy becomes a big emergency. Thank you for listening. Stay aware, stay treated, and of course, breathe freely. Namaskar.